Hi, my name is Abby Sturts. I'm a first semester nursing student here at Lincoln University. Today's date is April 19, 2016, and the time is 14:55. Today, I have an order to perform a nasal gastric insertion and nasal gastric removal. I have double-checked my physician's orders, and I have performed hand hygiene before walking into the room. I've identified my patient using two patient identifiers. I have assessed my patient's needs to need the nasal gastric tubing. I have assessed his mental status, if there's any gastric reflux, and I've also checked to see if there's any nasal blockage or any nasal surgery that has been done. I provided my patient with privacy, and I've also explained the procedure to him and answered any questions that he may have. I have put my patient in a comfortable working position and sitting him in high fallers. I will perform hand hygiene, and I am now ready to begin my procedure. At this point, I want to measure the tubing to make sure that it is right length for my patient. I will do that by measuring from the tip of the nose to the tip of the ear and then down to the xiphoid process. Which is about 50. So I would take and mark it so I know how far in I needed to put my tubing. At this point now, I am ready to lubricate the tip of my tubing 4 inches. At this point, I will want to ask my patient to hyperextend his neck for insertion. I would go in until I got to the oral pharynx, and then I would ask my patient to lower his neck. With each sip of water, I would go in another 2 to 4 inches, rotating at 180 degrees. Once I had my tube inserted, I would want to secure it. I'm securing it so that it does not fall out during the procedure. I would then take and I would want to listen to make sure that I have it into my patient's stomach, and I can do that by 3 ways. I can take my patient down to x-ray and have them x-ray it, or I can aspirate 10 milliliters of gastric juices from the stomach, and then the way I'm going to demonstrate today is the third way. I can put in 10 to 30 milliliters of air into my syringe, and I will listen for a whooshing sound on his stomach. And I heard a whooshing sound, which is what I wanted to hear. I would then at this point want to take and pin my tubing down to my patient's gown, giving some slack to make sure that it was not going to move anywhere. At this point, I would take and perform hand hygiene. I would lower my patient back down into a comfortable position, placing his call light in reach and making sure there was nothing else he needed before leaving. I would then want to go and document how well my patient tolerated the procedure, if there was any gastric secretions that came out, and the way I tested to make sure that my tubing was in the correct place. Now, at this point, I have an order to perform nasal gastric removal. I have double checked my physician's orders. I have identified my patient using 2 patient identifiers. I've explained the procedure to him, answered any questions that he may have, and I have provided my patient with privacy. I have performed hand hygiene, and now I am ready. At this point, I would want to remove my taping from his nose. I would ask my patient to take a deep breath and hold it while I remove his tubing smoothly. At this point, I would want to throw this away and perform hand hygienes. I would want to lower my patient back down into a comfortable position and put the call light within reach. I would then want to go and document how well the patient tolerated the procedure, if there was any secretions that came out, and if there was anything else that was abnormal about his findings. And that is how you perform nasogastric insertion and removal.